Hi everyone, in this video we're going to talk about some myths and common myths you hear about physical therapy. Before we dive into the specifics, I'm just going to give you a little story about me and my story about PT. If you've listened to my backstory, I tore my ACL when I was young, and I remember going to my surgeon. Well, actually, here's an even better story. I was coming out of surgery, and when you go to surgery, anything below your leg, they traditionally give you a nerve block so you don't feel the pain. So I woke up after my surgery, and I remember feeling the pain like someone tore and ripped open my leg. I don't say that to scare you, I say that can happen. So they rushed to me, gave me a nerve block, didn't feel my leg at all, and it felt pretty good. They put you in a brace, whatever. And usually after surgery, you have to go and use the bathroom prior to leaving the hospital. So I'm going to the bathroom, I had some help getting into the bathroom. And then not knowing in my mind, I'm like, oh, this feels pretty good. Let me try to put weight on this leg. I actually remember trying to put my right leg down and it gave out a little bit on me. I almost broke a brace. Yeah, this is like a crazy story. I say it again to preface the myths of PT. But if you are in surgery, make sure you listen appropriately to the surgical staff and don't put any weight on your leg. Let the pain meds do its thing and baby it for that first window. So that's my little story about that. I remember really just thinking like, damn, what did I do? Did I re-hurt this? What's happening? This is not good. But luckily, it ended up being good. So that's what I have to say about that. A couple myths we hear about PT. You know, after I left the hospital, I was like, oh man, I'm gonna have to go to PT. I'm just gonna get on a bike, do nothing. They're just gonna put my leg in ice and stuff like that, and that's it. So we're gonna review those myths, right? Especially if we're gonna talk ACL specific, we can think about that. Every injury is different, but ACL, traditionally, you're moving faster than you think. But a couple myths we hear and things that you may think is PT, that's not traditionally skilled PT, is all my PT does is heat, ice, and they put stim on me, and that's the only things that work. If you don't know what stim is where they put these electrical pads on your injury, and it sends an electrical current, and it helps with pain modulation. So that is a myth. That's not the only thing that's gonna work. They have their place when necessary, when there's an acute injury, but they're not the main priority and they're not gonna heal and fix your injury. The second one is PT is painful. I hear this all the time, it's a big myth. Hey, I'm gonna go to PT, it's gonna be painful, no pain, no gain. I'm not saying you're not gonna have pain, but it shouldn't be excruciating to the point where you dread going to PT. It's not a no pain, no gain type of atmosphere. A lot of times, a lot of things that PTs are doing for your injury are creating an influx to your nervous system. When they address your nervous system, it calms down your pain receptors and you're able to do exercise on top of that. So it's not PT is just strictly painful game. Another myth we hear when we have people who come with injuries is surgery is the only option to actually get better. I'm here to tell you that's not true. Surgery is an option, but it should be your last option. Now you're talking to me, I'm a physical therapist. I'm always gonna abide by physical therapists, but I will say there's a lot of physicians who will say the same. Exhaust all your conservative treatment before going into surgery, especially when it has to do with your spine, because I've seen miraculous things change when someone's spine is injured, where they're like, oh, surgery is the only thing that's gonna fix me. In reality, it's not. PT is only for injured people. This is something I hear a lot of. It's like, oh, I don't have pain, so I'm not gonna go to PT. You might have movement imbalances that can create pain in the future. It's important to have screenings. Just how people go to the dentist to get their teeth cleaned, you should really be going to a PT to look at how you're moving and say, hey, I need a movement screen. I need to check what's going on. And that could potentially save you down the road. Not saying it's gonna completely, but it's important to know how you're moving. It's important to know if you're asymmetrical and what part is moving and what not, and how to fix it and how to address it appropriately. A lot of people also think that PT is just stretching and massage. Very, very different. It can potentially be a part of what we do in PT sessions, but in reality, PT is increasing the nervous system to calm down, and then from there, progressively loading exercises to get you to your desired goal. It is a doctoral degree, it does take a lot of schooling to get there, and it's not just rubbing a tissue to make sure it feels good. So that's a common myth there. So if you like this video, why don't you hit the subscribe and like. We'll be pushing out more content like this. We want to educate you guys. Your feedback matters. Thanks for watching.